Hi, everyone. We're going to talk through the doctoral capstone, both project and experience, specific to Ohio State University's program. Hopefully, this will give you a little bit of better understanding of what exactly this whole process entails and what the project is and how the project relates to the experience. So our doctoral capstone is the development and implementation of one of the following: either a clinical practice guideline, and I use the word practice more than clinical because we practice in many different settings, but basically this is an individual intervention. They may also, the student might write a program guideline, so something like a group intervention. They might write a policy guideline, so an administrative or policy type of best practice, or education, which could be an individual or group intervention focused on education. Rarely we have had someone's doctoral capstone become a research study or part of a research study, but this is rare. And so I'm going to talk everyone through how we get to that this actually being a rare instance. When we look at ACODE, our accreditation body, they say that the capstone can have one of 8 areas of focus, one or more of 8 areas of focus. And so what I've done is gone back and looked at the last 4 years of capstones that we've had here at Ohio State and recorded just the primary area of focus for each of those. Most students do have 2 areas that they're looking at, but they have a primary area that they're learning more about. And so the capstone is supposed to give students an in-depth learning opportunity within one of these areas of focus. And so as you can see, we do have the largest number in practice, in occupational therapy practice. 111 have happened with that being the primary focus. But if you look at some of the topics within there, they do tend to be niche or emerging areas, interventions that are being seen. The next highest number is 99 in program and policy development. And so this, you can see again, are going to be most likely some emerging or niche areas of practice that we see working with caregivers, refugees, resettlements, intergenerational clinics, working with dementia. Some of these are very traditional and some of them are not. We have had 5 individuals do a capstone with the focus in education. And I think the default is to assume that this has to mean higher academic education, but it actually could also be patient education or even working with educators like K-12. We've had 2 have a main focus of leadership, one with a professional association, and one specifically interested in leadership styles in managers. And then we've had 7 with an administration. So this could be with a hospital-based administrator, with a private practice, considering entrepreneurship or quality improvement processes. And then we've only had 2 actually happen in the area of research. One ended up doing some focus groups with her population of interest, and one really looked at grantsmanship and grant development. The other 2 areas that we just have not used yet here at Ohio State is theory development and advocacy. Not that we couldn't in the future have a student interested in one of those 2 areas, we just haven't had that happen yet. So what does all of this involve? There's a lot of pre-experience activities and coursework. So that's really one of the big things that differentiates this from fieldwork, along with the area of focus being a little bit more niche or specialized. And then also, it's a lot of this pre-experience coursework that makes this really different. So students engage in, for Ohio State, a rigorous literature review, meaning they're doing a scoping or systematic review according to PRISMA guidelines. And the point of this is to discover the evidence-based active ingredients that comprise a successful intervention, group intervention, policy, educational process, whatever it is. And as part of that, they're going to grade the body of literature to determine the rigor. How well has this been studied? How strong is the recommendation that we follow these active ingredients that are coming from the literature? So if they're doing a scoping review, instead of following the grading recommendations, they'll be doing a concept map and creating themes that are arising out of the literature. The second piece of this then is the needs assessment. And this is really to discover the nuances of the problem, the population, the scope of what this looks like out in the world. And ultimately, they're going to go through this process to match the active ingredients that they put into their guideline from the literature to the site. So the literature says that best practice is 5 times a week of an hour group intervention with kids and typical peers. Well, the site is not able to do that, so they have to adjust to 3 times a week for half an hour without typical peers, right? Justifying what are those tweaks that are happening, but the active ingredients somehow need to ladder back to the literature. This needs assessment process will also lead to the determination of quality improvement versus research. So one of the big questions I get a lot is, well, is this research? And our project is designed as quality improvement through the use of a case study, a de-identified case study. And students will use the chart here for determining, is my specific project quality improvement versus research? And ultimately, the data our students collect is not meant to be generalizable, but is specific to the community partner site to improve the quality of the services that they provide. And so thinking about that may help students think about, they may want to go somewhere where there's been a previous Capstone experience, or to a site that already has this type of program or intervention in place if they really, really want to implement it. And I'll click on this chart and hopefully it will give us this on this same screen. No, it's not. Let me drag it over here for you guys to see. Okay, there it is. So this is a link to Ohio State's Office of Research, and this page is specifically about determining quality assurance, quality improvement versus research. So there's some definitions up here at the top. And then it asks, here's some questions for you to consider and answers. But the most helpful thing I find is this chart down here at the bottom. And so this gives examples of activities that normally fall in one bucket or another. So a project that is implementing a practice to improve internal quality of program or offering and collecting data regarding the implementation of that practice for program and administrative purposes. That's where we really try to have most of these fall. It could also be for clinical or administrative purposes that you're collecting patient or provider data. The goal is to improve outcomes, a program, or a service at the local site with no intention of creating generalizable knowledge. And that's really where we designed this to happen. A project involving collecting data to assess the process, the program, or the system, right? So kind of looking at, is what we currently do best practice, and is it working as well as we think it's working? You could also, again, do this. This is talking specifically about Ohio State, about a new program that's, collection of data, nothing new or novel as standard practice. So again, no intent to generalize. Where we get a little bit questions is where there's no standard of practice already accepted. So we're talking about something completely new. That's when we have to be really cautious about, can we actually implement this as part of the student's project, or is the project instead going to be looking at what would be necessary to bring this to become standard practice? And I'll talk a little bit more about that. So again, it usually is this bottom one that we're considering. The project involves manipulation or implementation of activities that may be considered other than standard of care or standard practice. Okay, so they're going to go through that and they're going to think about, well, what is my project? Is it falling specific to my site, my community partner? Where is it falling? So let's talk for a minute about what the actual project is. It's basically a de-identified case study where they apply their guideline. This guideline is developed prior to the experience and then is executed during the on-site Capstone experience. The unit of the case will vary based on the guideline developed and based on your determination of whether this would be quality improvement and is implementable, or is this actually going to fall in the bucket of research and therefore is not implementable. So if it's implementable, the unit of the case might be one client or one instance of a group. And so depending on what that is, it guides what sort of outcomes the student's going to be collecting. They might collect de-identified outcomes of the intervention with one client, or aggregate the data of the clients as a whole, this one instance of the program, or collect program level outcomes. If the project is deemed it would be research if we actually did this, then we have this option to do an implementation science approach and really look at the unit is the facility. And what the student's going to do is analyze what are the barriers present at this site that prevent this guideline from becoming standard of practice. And so they'll go through and they'll make some predictions about, well, there's probably barriers in cost or acceptability, or there's a list of outcomes based on an implementation science author, Dr. Proctor. So then they do this comprehensive analysis through stakeholder interviews, observation of practice patterns, and no matter which one they end up with, what the student will deliver to a site ultimately is a document that summarizes each of these steps that they've gone through. So let's take a look at that. So the final document is this big, basically assignment that they have for Ohio State in specific. It's the doctoral requirement for professional doctoral programs and that's in this last bullet here, that students will submit an original final document demonstrating original thinking, which for us is this grading and concept mapping, adding to it the needs assessment and creating this original guideline, and their ability to evaluate research. So again, that grade and concept map, and then how do they implement in the field, so out somewhere, not in the ivory towers, analytically. So we want to know that they can predict and collect outcomes. So again, through that literature review, they have an idea of how well this intervention works and what those active ingredients are. As they go to implement with their client or their group, they should be able to predict, well, all the literature showed that the clients had gains on this outcome measure and this one. And then if they're doing an analysis of the facility, they're going to predict where do they think the barriers lie. The barriers might lie in cost, in sustainability, in feasibility. And so in either one, they're making a prediction, and then they're collecting outcomes to see if their prediction was correct. And that's that, being able to do this analytically. So this whole final document, this whole thing is the doctoral requirement. It is akin to a research degree, PhD's dissertation. But for us, it's evaluating research in the field analytically, right? And really putting it to use. So you might be thinking, well, where do these things occur? They occur all over the place. So you can see we have a really widespread types of settings that we've been using. And it's important to note that any of the areas of focus can apply in any of the settings. I could be looking at administration in a tertiary medical site, at a community site, or at a community medical site. I could be looking at occupational therapy practice at any one of these sites. I could be looking at leadership at any of these sites. Program development, policy development can happen in any of these sites. As you can see, to this point, we've had just under half happen in these traditional hospital settings: acute care medical, acute behavioral health, inpatient rehab, outpatient rehab, or skilled nursing facilities. We have a pretty large percentage of 37% happening in these community non-medical sites. So cultural institutions, anywhere that's sort of open to the public, schools, military, sports. And then we've got about almost 20% happening at community medical sites where things like private practices, primary care, physician clinics, home health, behavioral health. And then we also have a really wide variety of site mentor professions. We've had 5 K-12 educators. That's been a combination of general education, special education, principals, and special education supervisors. We've had 5 physicians. And then we've had this sort of bucket of other healthcare professionals, exercise physiology. I'm sure that's not the appropriate abbreviation for that. Certified therapeutic recreation specialists, registered nurses, and physical therapists. We've had 21 social workers. Occupational therapy practice is actually really similar to social work in that we can go and move fluidly between these tertiary medical and community medical types of sites. We've had 10 with higher education professionals as mentors. We've had 21 with the site administrator, program manager, or owner of the business. And then the largest percent has been occupational therapists. So we'll stop there for now, and the next video will kind of get into a little bit more about how the project overlaps with the experience, what those learning objectives are, and how to create the activities.